The next step is Spiron operation. Short explanation for technicians. We will go for the general steps for Spiron operation. The hip implantation in general starts with reamer. You have different cup reamer. We have different options. We will talk about it in a separate video. And so you ream the cup and do the normal cup implantation, like reaming, eventually trial, and inserting with standard inserter or minimal invasive inserter, and then you place the inlay. After you did this, you take a saw and start subcapital cutting. If you are in doubt, just not cut too deep, better cut a little bit higher. So after this, you will have the situation that you have here the femoral neck, and if there is something bigger osteophytes, you will make it round. And now you could start with checking the size with these little coins, so you can check how is the bone coverage. In this case it could be the biggest, the 24. Please note that this is the biggest, represents the biggest part of the Spiron. After this, you will start to place the central wire. It's a long wire, and we have two different options. Now I'm going for the option with a smooth edge at the front. Look at the option video for the other one. And so the question is how to put this in the correct position. To do this, you have the option to use this guide and to place it in the bone, and the assistant will check and then you will drill it inside. Or you have this option with this wire to do it. Or there's another instrument, sees a separate video which exactly is able to position the correct angle, but this is not able to be done in any approach. So we will go in the lateral bone. We touch the lateral cortical bone from inside, yeah, but we not go through. Normally you do this with a reamer, and then you feel that you stop here. When you did this, then you should first measure. Where are we? So you take it out again, and you have options to measure. This is a measuring wire, or I like more the screwdriver. The screwdriver is not only a screwdriver, it can be used for measuring. You go in, touch the lateral cortical bone from inside, and then you take it out, and then you measure. For example, almost 70 millimeter in this case. So you plant, instead of a 65 or 60 or something, you plant a 50. So we know we want to ream down. And so we take this instrument. Here can be done in 18, 20, 22, 24. And then over the wire, we go here and make flat reaming. So after, we can repeat it, measuring, reaming, measuring, reaming. We come to a final measurement, which could be, for example, 59 millimeters. And the Spiron exists in 5 millimeter steps, so 59. So we will suggest a 55 Spiron, 4 millimeters shorter, or a 50 Spiron, 9 millimeters shorter. To do this Spiron now, we need the so-called Spiron rasts, which are in fact drills. This drill is having a scale. We start with the 18, and now we adjust here a 50 millimeter. 50 is done when you can read the 50 millimeter here. Then it's a 50. So we have the diameter of the Spiron size, and we have the length of the Spiron size. And then you go in and ream, and start with the smallest. So in this case, for example, an 18. Now we make a short option. You could now go for a trial Spiron and place it inside, and you can now do a trial reduction, check the leg length, check where you are. It's an optional step. If you don't you go further. So in this case we decided it is a male person and it has a big femoral neck, and we measured with this blue coins 24, and we think it will be a 24. So we go step by step until we have the recommended size. Actually it was pre-built only 22 in this case. Then we go here that we have the final size, and it's reaming, it's a drill. Note for the drill that the drill is sharp when it cuts right turning, but anti-clockwise it's smooth. So in case of weak bone we recommend turning left, and in case of hard bone we recommend turning right. So maybe you start with turning left, and when you're not going down then you can start right because it cuts more, you will feel it. So final Spiron seating hole is done when you have this last drill, for example 24-50, and now we are fine, we can start the implantation. It will be put inside, just a short break for an option. If you are not feeling well with the quality of this area, there is an option to repeat the reaming with a fine reamer. You put it on the drill and you can fix it here with screws, and you can check again the length that you go turn it on a 50 length, and then here there's a sign on it, it gives the direction, and then you can make a flat reaming and it gives a smooth surface. So last drill was done, maybe optional fine reaming was done, so you have a hole, and the hole is smaller than the Spiron. So we have this situation. It's important, as we talked in the planning, not contact the lateral bone here. Spiron has to be shorter than the length of the canal. And now we have done it, for example, with a 20 drill. This is the 20 Spiron. The diameter here is 20, but the drill is smaller. So this means that during putting the prosthesis inside, we will have a compression of the bone first. So it's a press fit fixation. It's conical, so it will go like press fit stem. Second, we have the screw fixation. And third, because the hole is much smaller, this is the shape of the hole and this is the shape of the prosthesis. For example, we see in this size 32 square millimeters over surface, and here it's much bigger. The bone is cutted out, and the bone which comes out will be put here inside the spiral holes, and so the implantation is in fresh bone, and the implantation is done very simply with this instrument. The assistant should correct, because I can see from here, but I cannot look the same time the other direction. And then you should check that it's very good, the position, and you will feel it will sometimes be very hard to go down. And check our optional extensions available for very hard bone. And then you go down and you should be flat on this neck, and that's the final position.